Welcome to this explainer, where we're going to look at how a totally simple neighborhood hobby is actually a highly effective, evidence-based public health intervention. If you've ever walked past a local community garden and just thought, oh, look, some folks growing a few tomatoes for fun, well, get ready, because we're about to completely shift your perspective on that.
Okay, let's just dive right into this by completely challenging how we think about health infrastructure. Normally, when we hear the phrase public health intervention, we naturally picture sterile clinics, massive vaccination drives, or some huge government policy, right? But today, we're actually moving way beyond the clinics and looking straight into the soil. We're going to explore how a simple, everyday patch of dirt can literally transform the health of entire communities.
So, here's our agenda for today. We're going macro to micro. First, gardens as public health tools. Second, oases and food deserts. Third, harvesting social capital. Fourth, growing healthy kids. And finally, safe and sustainable leadership.
All right, kicking things off with Section 1, Gardens as Public Health Tools, and why they are so much more than a hobby.
When you think of leading researchers or organizations like the CDC, you probably don't picture them endorsing a neighborhood vegetable patch. But they actually view these green plots as essential health infrastructure. It turns out getting your hands a little dirty is a direct dietary intervention. Studies from all across the country consistently link community garden participation to higher fruit and vegetable intake. Whether it's right in the middle of an urban center or out in a rural town, researchers find that adults involved in these gardens just eat vegetables more often. They have much stronger seasonal food habits, and they see improved overall diet quality. It literally shifts daily food habits right at the source, making it a frontline tool for health equity and, believe it or not, obesity intervention.
Moving right along to Section 2, Oases in Food Deserts and Tackling Insecurity.
Now, we need to step into areas that are completely lacking fresh food. We're talking about places where the local grocery store might literally just be a gas station convenience mart. In these designated food deserts, a community garden acts as a literal oasis of nutrition. When affordable, fresh produce is geographically out of reach, a local garden physically drops a source of vitamins and fiber directly into the neighborhood. It completely bypasses those huge barriers of transportation and cost.
And this brings us to a really stark daily choice that residents in these areas face. On one hand, you have highly available, highly processed fast foods. On the other, the affordable, nutrient-dense harvest that a local plot can provide. Public health data actually shows that by offering a direct, physical alternative to processed foods, community gardens actively fight seasonal food insecurity. They significantly lower the cost barrier to getting a nutrient-adequate diet. It's a real game changer.
But here is the truly amazing part. The impact absolutely does not stop at the garden gate. Extension programs, like those at the University of Minnesota and the University of Illinois, report that massive networks of these gardens donate their specific, colorful crops directly to local food pantries. This is absolutely crucial because emergency food systems often have to rely on shelf-stable boxed goods. So injecting fresh tomatoes, hardy root vegetables, and iron-rich greens directly into the local pantry, it completely transforms the nutritional profile of local hunger relief.
Okay, let's jump into Section 3. Harvesting social capital and cultivating community.
We've talked a lot about the plants themselves, but now let's look at the human connections grown right alongside that food. Research from public health reviews indicates that social capital directly translates to food security. And why is that? Well, it's because neighbors in these gardens aren't just out there weeding in silence. They are actively talking. They're sharing gardening knowledge. They're swapping culturally relevant recipes. And most importantly, they are distributing excess harvests to those in need. This level of cooperation builds a real, tangible safety net of shared resources. As the research points out, working together in a shared space does two things at once. It reduces the burden of seasonal food insecurity while simultaneously strengthening community bonds. You know, you are not just growing food out there. You're growing a network of people who genuinely look out for one another's well-being and nutritional needs.
Let's zoom way in now for Section 4. Growing healthy kids at the micro level.
We are going right into the schoolyard and early care centers for this one, and the data here is just undeniable. USDA and extension records overwhelmingly prove that when kids are actually involved in planting the seeds, watering the soil, and harvesting the crop themselves, their willingness to actually eat those vegetables absolutely skyrockets. Garden-based learning completely removes the intimidation factor of trying new, healthy foods.
Programs like the USDA's SNAP-Ed completely integrate the garden directly into the curriculum. So it's not just a fun little field trip outside, right? It is hands-on nutrition education. They pair playing in the dirt with actual taste tests and cooking demos to shape lifelong dietary habits right at the source. It replaces that age-old dinner table battle of getting kids to eat their broccoli with the pride of knowing they grew it themselves. Kids learn about edible plant parts, they get outside for increased physical activity, and it just seamlessly bridges what they learn in the classroom with what ends up on their tray in the cafeteria.
Finally, we reach Section 5, Safe and Sustainable Leadership, Grounding the Ideal.
Because let's be real, to make sure this public health tool actually works long-term, we have to talk about keeping these spaces safe and sustainable. A garden doesn't just run itself. Without active garden leadership, trained coordinators, and truly dedicated volunteers, these beautiful plots risk becoming overgrown and totally abandoned. And that is exactly why University Extension services across the country step in to offer intensive virtual and hands-on leadership training. They help turn informal plots of land into highly organized, sustainable health interventions that can actually weather changing seasons and volunteer turnover.
And then, of course, there's the physical safety of the food itself. Especially when you're transforming urban brownfields or vacant lots into agriculture hubs, the EPA and local health agencies mandate some pretty strict food safety protocols. First, you absolutely must conduct thorough soil testing to check for heavy metals or past contaminants. Second, you have to implement safe manure practices to avoid any dangerous bacteria. And third, use proper harvesting and handling hygiene. All of this ensures that this incredible health intervention doesn't accidentally end up causing harm.
As we wrap up this explainer, I really want you to look at the vacant lots or underutilized spaces in your own city just a little bit differently today. Try not to look at them as just empty space, but as untapped public health potential that is literally waiting to be planted. How could a simple patch of soil transform the health, the connections, and the nutrition of your own neighborhood? Thank you so much for learning with me today, and definitely keep exploring the amazing science of how our environments shape our health.